I'd like to say good evening to all of you that are here. I am just loving seeing all these faces. And I think what warms my heart most of all is the opportunity that I had to review all of the student work over the past couple of months. And I am just so impressed and so grateful to you, student health ambassadors, for your commitment, your tenacity. I know you were juggling, and I know this wasn't easy, but I hope for you, as I know it is for me, that it was worth it. So, I want to just take note of our theme for the symposium, which really reflects our work with our valued community partners. Some of them are connected tonight. And if you have not muted your microphone, please do so right now. But some of our partners are with us tonight, and we're just grateful to them as well. And so the work that you did, the work that was implemented, projects on COVID, HIV, hypertension, obesity, mental wellness, and under mental wellness, I'm sorry, would you please mute your microphone? Under mental wellness was depression, was suicide, and then there were projects done on domestic violence and preconception health. So on behalf of Dr. James E.K. Hildreth, who is the president and CEO of Meharry Medical College, on behalf of Dr. Miller Collins, who is our division chair, on behalf of the community residents across the state of Tennessee where these projects were implemented, we thank you. We are very grateful for your work, and your work does matter. So when you think about the part of our theme that talks about our policymakers, I think of the legislators for the legislators within the realm of the Black Caucus, but also the other legislators who agreed to continue to fund this project. I think about the Tennessee Department of Health, those officials who support us, and not only just support us in words, but they support us in deeds. And so there are a couple of initiatives that were funded as a result of the affirmation from the Tennessee Department of Health. I think about Metro Health Department. We were able to do the COVID initiative with Fisk University and Tennessee State University, which will hopefully translate into strategies that the Centers for Disease Control will utilize or will develop when they think about the population of young people 18 to 24 years old. I also want to acknowledge in gratitude the Multiple Myeloma Research Foundation, who provided funding to look at multiple myeloma in our communities of color, because we are the ones that are disproportionately affected. And so we're grateful to them. So again, thinking about our policymakers, thinking about how your work translates into strategies, into information, how the findings hopefully will guide discussion and strategies to better impact outcomes. So your roles, students, continue to be vital and we just applaud you for this important work that truly matters. And so as we get ready to hear all of the projects that will be presented tonight, understanding that this represents a small portion, and you will hear later how to access our website to view all of the work that has been done over the past year. I also want to take a little time to just acknowledge the team and of just wonderful individuals who never say no, who always step up, and they do it because of you. They also do it because of the significance of what it is that you do. So I'd like to acknowledge Dr. Wansu M, Dr. Frida Outlaw, Dr. Kimberly Weich Etheridge, who is always looking to seek ways for us to be funded to keep the projects going. I think about Dr. Leah Alexander, who you will hear from in just a few moments. Mrs. Twanda Scott, who keeps the operations and administrative portion of what we do moving in the right direction. Mrs. Christina Haygood, who just guides the Fisk, the MTSU, and the Austin Peay State University students so magnificently. Dr. Calverta McMorris, who continues to work with our TSU cohort, but also brings a wealth of experience with her. So I just want to also take a little time to acknowledge Mrs. Jonay Woods, who is just so expert at what she does in promotions and marketing and the technical side of what it is that we do. Without all of these individuals, we couldn't function. So thank you so much to all of you. And I will turn the microphone over to the next person who is going to continue to guide us through this.
Dr. Richardson.
Good afternoon, everyone. My name is Dr. Richardson, and I am at LeMoyne-Owen College, and I serve as the Division Chair of Natural and Mathematical Sciences. And I have the pleasure of introducing two wonderful young men that will be presenting on tonight. The first young man is going to be Chauncey Adams, and following Chauncey Adams, we will have Eldrian Harville. Chauncey?
Yes, ma'am. I just need to share my screen.
You should be able to. We can see it. You are muted though, Chauncey, so we can't hear you.
Can you hear me now?
Yes, you're right ahead.
I did my project on increasing awareness and mental health in athletes at HBCUs. Going to the next one. Did it change on yours? Some background information. Mental health is a state of well-being that enables people to cope with the stresses of life, realize their abilities, and learn well and work well and contribute to their community. 1 in 5 people suffer from one mental health disorder during their lifetime. In addition, a larger percentage of college athletes suffer from mental health disorders. Currently, 30% of women and 25% of men that participate in college athletics suffer from some form of mental health disorder, but only 10% of those students actually seek help. The objective and the aim of this study was to increase the awareness among other college athletes about mental health and its effects and things you could do to help. So we did a survey of 100 HBCU college athletes from the ages 18 to 26. And we partner with NAMI of Memphis and LeMoyne-Owen College Counseling Center. And we also partner with the athletic department to host an informational session on mental health awareness. And during the information, we did a pre-test to see people's knowledge of what they thought about mental health as far as what they thought it was and things of that nature. And we also administered a post-test after. These are some of the charts that we got from during our post-test and pre-test. So we found out that at least 25% of students report suffering from depression or anxiety while being in college. 46% of students also were unaware that one in five people suffer from a mental illness, and they didn't realize that it was so common. 15% of participants also thought that mental health was something that could not be treated, and 20% of participants felt like that mental health came from someone being weak or not having the willpower. And these are, the red indicates the pre-test answers and the green is the post-test answers. So we had a great impression on people to be able to determine the different types of mental health and what they thought mental health consisted of at first. They were able to tell that 1 in 5 people can suffer from a mental health illness. And here are some acknowledgements that helped me get through this project.
Thank you, Mr. Adams, for that presentation. If you would stop sharing your screen, and Mr. Harvell, go ahead and share your screen, please.
My name is Eldrin Harvell, and I had hypertension. Education is the key to decreasing hypertension rates in the African American community. Background: hypertension is a disease characterized by having blood pressure reading 120/80. In the United States, nearly 47% of adults population suffer from hypertension. 1 million hypertension-related deaths happen in the U.S. each year. It has been reported that unmanaged hypertension can lead to serious chronic diseases such as heart attack, stroke, renal failure, and death. More importantly, these conditions tend to be more severe in Black community. The prevalence of high blood pressure among Black adults in the United States is among the highest in the world, affecting approximately 55% of Black individuals. The objective of my presentation is the purpose of the project is to increase high blood pressure awareness in the African American community. Methods: 50 participants between the ages of 18 and 70 were recruited by flyers, emails, and social medias. We partnered with Church Health and the LOC Health Center to host an information session aimed at increasing high blood pressure awareness in the Black community. Participants were screened pre-test to establish a baseline on hypertension awareness. Following the pre-test, they were given a post-test. Demographics. So it's about 39% of 45 to 54-year-olds have hypertension. About 22% of 35 through 44-year-olds have hypertension. And about 22% also have, from the ages of 25 to 34, have hypertension. We had about 50% of people say they had hypertension, mostly women. Right here, it says, how often people usually check their hypertension once a month? About 30% of people check their hypertension once a month. So we did a little test. 55% of people said they have high blood pressure, and then about 50% of people said they have prescribed medication for hypertension. About 55% of people also said they have the medicine to take for it, and about 50% of people said they have the medicine that's prescribed to take for it. Student lesson learned: hypertension is a preventable disease. Participants do not follow doctor orders. That's usually why they continue to have hypertension. Participants do not fully understand the consequences of controlling their hypertension, such as death and other diseases. Acknowledgements. I want to acknowledge the wellness program, HBCU wellness program, the Churchill of Memphis, Dr. Richardson LLC Health Center. Thank you for your time.
Good job, Mr. Harvell. Thank you.
All right. I would like to introduce and present to most of you, because most of you know Dr. Leah Alexander, who's the division chair of public health practice here at Meharry Medical College. But she also has the distinction of working with an NIH sponsored program that deals with community engagement studios. And community engagement studios, and I'm not going to go all into it, but it is going to be a mechanism that will help all you returning students and the new students, better engage with the community through working with researchers on the various topics that you choose. And so to keep things moving, I'd like to present and introduce Dr. Leah Alexander.
Hello, everyone. Good evening. This is so wonderful. It's almost 90 people on this call. That's so exciting. I think it's a testament to the work of the HBCU Wellness Project. So I am glad to be here to just talk briefly about community engagement studios and a plan that we have for the summer when you all are on campus with us. So next slide, please. So I also want to congratulate the students on, stepping your toe into the world of research. For many of us, we've come to love, what we do, love research, because it, allows us to think about solutions to problems, especially for communities that we, love, that we're a part of. It's so exciting to, begin to hear about some of the work that you're doing. So we have this activity that we do with researchers here at Meharry, and it's called Community Engagement Studios. Basically, this process was designed to help researchers improve their projects. And so we look for community folks that have lived experience with some of the diseases that you all will be talking about tonight. And we create an opportunity for the researcher to present their project to community before they engage in the project. So before you go out and try to recruit people, before you design your surveys, before you, actually start collecting data, we create an opportunity to bring community in to hear about your project and offer advice. So some of the reasons that we do this, one is to build trust with researchers and community. And I know, many of you probably have already learned about, some of the ethical issues that we've had with research, some of the reasons why folks in our community don't like research, right? Or don't want to participate in research, or don't trust researchers. So the Community Engagement Studio is an opportunity for us to have this sort of two-way conversation with community But what we've learned is sometimes the language that researchers talk isn't the same language that community folks talk. So we really focus on this two-way or bi-directional communication. We also conduct community engagement studios so that researchers can learn from community experts, because oftentimes community folks, if they have lived experience, say, we just heard about high blood pressure. If you're designing a project to deal with high blood pressure, wouldn't it be wonderful to actually hear from someone that is living with the condition and let them chime in on your research project? So we feel like there's a mutual benefit for the community experts that participate in community engagement studios, as well as the researchers. So what we would like to do, next slide, when you all come to Meharry in the summer, we want to offer to you all to conduct community engagement studios for the research projects that you will be designing. So we will work with students in groups. So we all, we're looking forward to hearing all of the different diseases and health conditions that you all are interested in working on when you return back home, back to your community. So we're gonna put students in groups based on the topics that they pick for their projects. And we're actually going to recruit community folks to come in and hear about your projects and offer you suggestions to sort of help you improve your projects before you go home and implement. So as you see on this slide, I don't want to take time to read each and every line to you, but one of the things that we do is find the experts. We'll create the opportunity for you all to work together and have these bi-directional conversations where they will learn about your project. We will also provide a little bit of a compensation for the experts, and then we will provide you all with notes. So community engagement studios, it's an opportunity for you all to refine your projects before you return home. And we are working now on a process to engage you all in studios this summer. So I'm looking forward to seeing everybody when you get here, and have a good night.
Okay, I believe we're next. Hi, everyone. My name is Alexis Hurley, and I serve as a coordinator at the University of Tennessee at Chattanooga. I serve alongside our primary coordinator, Dr. Shawani Howard-Baptiste, our Vice Provost for Academic Outreach. And I feel very privileged to introduce our two student health ambassadors that are with us tonight, Miss Brianna Evans and Miss Kiara Sutton.
Hi everyone, I'm Brianna Evans, and our health disparity was hypertension, also known as high blood pressure, which previously stated is above 120/80 as the reading, but also known as reading as 140/90. And if it's in between those two, it could be stated as being pre-hypertension. And I attend the University of Tennessee at Chattanooga as a senior, majoring in exercise science and psychology. And my population for this project were parents in both Hamilton County and Rutherford counties. And the parental shopping habits or impact and awareness was the title for this project. And the purpose was viewing the purchasing habits amongst parents I use as a tool to explain the patterns we see in their selections when they go to their local grocery store. And also the purpose was to determine the parent purchasing habits of the foods that they select. The project aimed to discover similarities and differences between their decisions, with a total of respondents 93 parents in the 2 counties in Tennessee. The methods being sharing a flyer and using a short survey that had 15 questions made through the Qualtrics platform. And the link was easily accessible on a digital platform and via a paper copy of the flyer that was shared on Facebook and LinkedIn, where parents could access the QR code and link for the survey. And the expected results were determining the factors that influenced their choices for purchasing their whatever it was they got at the stores for themselves and their families, and seeing the different factors that contributed to that, including economic barriers and transportation and just overall food preference, help better understand the health habits of their household. And the results being that 22% of the parents were hypertensive, and we overall just wanted to see how they thought about how their food choices interacted with developing hypertension, and with the conclusion being that there are hopes of leading to more produce consumption and better heart health to lower hypertension risk factors in Hamilton and Rutherford counties. And having this increased knowledge of nutrition, 77% of the parents said that they learned from an image I incorporated in the survey they took. And two of the cities where people were from who took the survey, from Smyrna and Chattanooga, they could benefit from learning more about health literacy and ways to lower the risk factors of developing hypertension. And the outcomes and what I learned about this project was, first, by relaying the information through an easily accessible way for parents to get to it, by sharing the survey I have in this upper right-hand corner. And then with the first graph being about between mothers and fathers, they saw that 93% of the mothers, there are 67 of them, they did most of the grocery shopping in their household, opposed to the fathers, they contributed more towards actually preparing the meals for their home when their families would eat. And when I mentioned the 77% down below is the other graph I used in my project, where parents said that they learned from the image that I incorporated about how many fruits and vegetables their children should have per day, which is 4 to 5. And seeing how all this knowledge was acquired from a short survey, it can be more impactful by reaching out to more people. And I want to thank everyone who is a part of the HBCU Wellness Project, my advisors, Dr. Shawani Howard-Baptiste and Alexis Hurley, and the Rutherford County Junior Basketball League, who partnered with me during this experience. I'll continue to learn and grow as a researcher during my time at the University of Missouri as a student in the doctoral program for occupational therapy. Thank you very much.
Thank you, Brianna. Well done. Kiara, we will have you begin your share screen.
Oops. Kiara, do you need some assistance?
I think so. I don't know if it's like sharing or not.
It's not right now.
Okay.
From the bottom corner where it has the share screen, you should have the option.
Yeah, I'm on it. It's saying like desktop 1, but it's not like showing.
Okay. Well, if it doesn't pull up and you would like to just come on camera and just talk to us, you also have that option as well.
Okay.
Kiara, do you have two screens in front of you?
Yeah.
Try to drag it over into another screen if you'd like to.
They're
If
not
not,
a part of the same like computer.
if not, feel free to go ahead and speak if you would like to without it.
Okay. I'm going to show the video. Okay, whatever. Okay, I did, hold on, let me share. Start my video. I did, okay, let me start over. Hello, everyone. My name is Kiara Sutton. I'm a student at the University of Tennessee at Chattanooga, and the focus of my research centers on the intersection of hypertension and obesity, encapsulated in the title, that was my title, the college lifestyle and environment influence on hypertension. So my study investigated risk factors for hypertension among college age adults with focus on lifestyle in the campus environment at the University of Tennessee at Chattanooga. It provides insights into how campus lifestyle influence student health, especially concerning hypertension and obesity, and offers data contributing to understanding college life impact on health outcomes, and also suggesting potential programs to reduce chronic disease and among young adults. The objectives of my study was to identify environmental factors contributing to the progression of hypertension and the risk of obesity, with a focus on investigating significant risk variables. So understanding these factors is crucial for improving public health and reducing causes of obesity-induced hypertension due to the global rise and obesity presenting significant health challenges, including chronic diseases. Hypertension is a focal point due to its high prevalence and clinical significance as a comorbidity, and with obesity, which highlights the complexity, complex dual relationships between the two conditions, where prevention efforts targeting one might impact the other one. The study aims to assess environmental risk factors contributing to obesity among college students aged 18 to 25. The participants were recruited through QR codes on campus, flyers offering incentives, and their behaviors were evaluated using a self-administered standardized survey focused on dietary habits, physical activities, sleep patterns, food choices, and study habits. And they were conducted on Qualtrics. It was an online platform for data collection. My findings from the study highlighted concerning lack of awareness among college students regarding hypertension and its health risk, with around 41% of respondents unaware of the condition factors, and also dietary habits among participants revealed prevalent consumption of sugary, processed, or junk food on a daily basis by approximately 70%, while 36% reported daily intake of fruits and vegetables. Despite the availability of fresh food on campus, around 93% of students did not utilize that event. Physical activities levels varied, with 60% of students averaging around 3,000 to 9,000 steps per day. And this can be divided into three groups. So 3,000 to 5,000 and 5,000 to 7,000, with 20% in each group. The stress management practices were reported as minimal by a significant portion, around 46% of participants, and with 41% indicating barely any stress management efforts at all. From this, I learned what contributing factors could lead to hypertension and ways to combat those. And I also learned that there are not a lot of college students or young people who are familiar with these factors, which I believe will be detrimental in their futures. And that's it.
Thank you both. Very proud of y'all.
All right, well, up next, we have Fisk University, and we're going to start off with Mr. Maurice Thomas II. Do not leave the second off of his name because he is Maurice Thomas II. Maurice has been with me as a student health ambassador at Fisk since 2001, and I can't believe it. Now he's about to graduate. He started as a sophomore, which we love for you all to do, and you can continue your work. He has a passion for mental health awareness with a particular focus on African-American and Latino boys and girls, particularly with ADHD, but all mental health. So this year and all of his years, he's focused his work as well as his senior thesis on mental health awareness. So he's going to be up first. And then we have Miss Brianna Elibo Mendes. This is her first year with us at Fisk University, and she has been invaluable. Anytime I ask Brianna to do anything outside of the norm of SHA responsibilities, she always does it without complaining or any issue. I'm so happy to have her with us. She, this year, worked with one of our valued community partners doing hypertension and stroke awareness. So with that being said, I'm going to turn it over to the Fisk University Student Health Ambassadors.
Okay. Good evening, everyone. My name is Maurice Thomas II. I'm a senior psychology major from Mobile, Alabama. And my research is on the relationship between media consumption and the mental health of Black and Latino young adults. And so, I'm not enjoying this study. Okay, great. So the reason why I chose this study is because I really wanted to look into mental health just in general. But then over the summer, I had a research opportunity where my mentor was in the field of communications, and let's just say, like, I didn't understand it. But somehow I connected it to media and mental health, and that's how we got here. So a lot of my focus is on how that affects, how media affects depression specifically, along with the suicide rates. So if you see that between the ages of 10 and 34, there is a huge increase since 2000 of people committing suicide, and that depression is oftenly associated with social media. So like for majority of my research, I really tried to stay focused on the issues facing my own community, but to also try to focus on another community, which is where the Latino community. And so my methodology for this particular project was to recruit at least 30 individuals. Thankfully, I was received over that. But the way I'm recruiting that was through social media platforms such as Instagram, GroupMe, and Facebook, to be specific. And for the sake of this study and the way that HBCU wellness research works, we do a pre-test and post-test way of operating things. And so I did create a pre and post test just to determine how people's emotions were about social media. I didn't want to ask quantitative questions, so I really focused on the emotions of it all. So one of the questions that I asked is, on average, how much time do you spend on social media? And a lot of the answers were from 30 minutes to 3 hours. And so luckily, through this opportunity, I became very well connected with a PhD student who presented. Her name is Kristen Lear, and she receiving her PhD at the University of Michigan Ann Arbor, and she talked about social media and depression amongst these two minorities. And so, like I stated, the outcomes were over 100 participants attended this virtual event, and there was an increase of scores from the pre-test and post-test, with the overall consensus of each participant learning something new about social media and how that affects their mental health. So I thought that was pretty interesting to see. And then what I've learned from this experience is that there just needs to be more research done on like these two minority groups, specifically Black and Latinos, on like how different forms of media affects their mental health, but also what can we do about that? And one of the ways that I plan on doing that or raising awareness about it is by encouraging more minorities to go into the mental health field, and that I think would be able to help with culturally specific issues such as depression and anxiety. And so I would like to acknowledge my speaker, Kristen Lear, who is the PhD student, like I stated, at the University of Michigan Ann Arbor, for her expertise, as well as Meharry Medical College for providing me with the opportunity to expand upon my research compared to last year, because it's very different. So thank you so much.
Hello, everyone. Can you hear me? I'm not sure. Sorry, my headphones may be
Yeah.
too
We can hear
scratchy.
you.
All right, thank you. Well, hello and good evening, everyone. I hope you are all doing well. I'm Brianna Libo Mendez. I'm a junior biology major here at Fisk University, and I'm a first-year student health ambassador. And as Ms. Hager so lovely mentioned, this year my main topic was hypertension and stroke and heart health prevention. But as also Dr. McGee mentioned in the beginning, Fisk University had the opportunity to partner with TSU and the Department of Health on doing a COVID research project. So I will talk more about this second project that I had the great opportunity of doing. So we conducted different COVID listening sessions. So this is a recap on the one I conducted. The aim of the session was to ascertain the thoughts and personal habits and behaviors of African Americans from the ages of 18 to 24 in the Nashville area. As we know, COVID is something we were dealing with for about 4 years now, but it is still prevalent to this day, so we wanted to gauge how people felt about it today. So adults aged 18 to 24, as well as non-Hispanic Black adults and those with less education, no insurance, and lower household incomes had the lowest reported vaccination coverage and intent to get vaccinated. One major thing I covered in this research was vaccine hesitancy and trying to figure out what factors contributed to the hesitancy of people in our community getting vaccines. So by conducting this session, I was able to provide an opportunity for those in our community to learn more about how this disease specifically affects our underserved community, and as well clear any misconceptions that may have been present, and overall, the importance of getting this vaccine. So in order to effectively reach my aim, we utilize various virtual recruiting methods, such as GroupMe, Instagram, emails to the students, just as much engagement as possible to reach out to our campus community. So like I said earlier, the main topic I focused on was vaccine hesitancy. Many participants expressed that they were apprehensive to receive any form of COVID vaccination due to various reasons. Beginning with, many believed that there wasn't much information as to the specifics of the vaccine, like what's in it, how the whole process works in our body biologically. There was also some apprehensiveness due to the fact that vaccines seemed mandatory. I remember at the time it was mandatory for us to go back to school and work. So many people felt like they were obliged to get it and could not return to their normal day-to-day lives without receiving this vaccine. So they did not have ample time to research and weigh the pros and cons of getting this. Participants also stated they only received the vaccine, like I mentioned, due to the fact it was required for them to work. So I remember many people were opposed to it because they felt like there was a sense of control behind that, and they were just wanted more information at the end of the day. Some metrics on my event overall, on my session, where we actually reached 72 participants. It was an hour and a half long session about. We got a nice few of Q&A interactions and positive feedback based on our surveys. So a few questions that were brought up during the session were, is the vaccine still currently mandatory to this day? I do not believe it is, as many people have already received the vaccine, but I believe some booster shots are still being contemplated and still being weighed out if it's mandatory. Another question that was asked, if do we believe booster shots were necessary after having the 1 to 2 doses? Many people did not were unsure if the third or even fourth dose was necessary. And also we were asking what locations were the most accessible for the participants were asking what different locations in the area were accessible to get the vaccine. Many people did not have access to, clinics and hospitals were the first to get these doses of vaccines. So they weren't sure if like local pharmacies or local doctors' offices had these available to the public. So one major final takeaway from my session was I learned the importance of spreading vital information to marginalized communities and utilizing this information for good and to promote healthy habits and prevention, as it's important to think of the greater good as far as vaccines. I know there's a lot of stigma around it, but when dealing with a global pandemic such as COVID-19, it was important to think of not only yourself, but others around you. And that was the main takeaway. Thank you. And I forgot to include some acknowledgements, but I just really want to thank Ms. Haygood for all the support and help, Ms. Woods, Dr. McGee, and everyone a part of the HBCU Wellness Project.
Great job, Brady. I said that in my comments. And just to mention, I didn't say this before, but all of the Fisk University, so I'm gonna big them up right quick. All of the Fisk University students did 2 projects. They were only required to do the COVID-19 project, but so many of them have an interest in public health and health disparities reduction. They decided to take on one of the other topics that we offer, one of the top health disparities that are plaguing African Americans in the world. So shout out to them for doing 2 projects. We were crazy busy this year, but they did 2 projects. Every student at Fisk did 2 projects this year. So that was 30 projects just at Fisk University alone. So congratulations. And I also want to thank Dr. Stevenson. She is our Fisk University campus principal investigator. She's on the call. So I want to thank you for all of your help. You have been an invaluable resource for us to get things done at Fisk University. So thank you. And then finally, I want to say also, Brianna is bilingual, and at our event last summer that we conducted in community, she served as a translator for participants because Dr. Kim was the only other person there that was bilingual, and she was overwhelmed. So she had too many people, and Bree helped her. So that, once again, I meant to say that earlier, so please forgive me. Now we're going to go into my other students. So first up, I am very excited about the first 2 group of presenters because I didn't know anything about what they were doing. They were working on multiple myeloma. I had never heard of multiple myeloma. There is very little research. So this was extremely informative for me. Having been with the HBCU Wellness Project since the beginning, I've seen a whole lot. I've seen a lot of repetition. This is not anything that I've ever seen. And so it was pretty cool. They did their work. Sophia Thomas and Catrice Grisby. Sophia is at Fisk University. Catrice is at MTSU. They worked together to do their project and they did a fantastic job. So you get to hear more about that. And then we have Miss, Tempest. Hey, no, it's Amaya. I'm sorry, it's not Tempest. I'm looking at my sheet, but it's not. Then we have Amaya White. She is a first-year student health ambassador. Let me say, all of my students this year at MTSU are freshmen. This is if you want to see a stellar group of freshmen, this is the group. Like, I am so impressed with them. I can't even wait to see them when they get to be seniors because they're amazing now as freshmen. So by the time they become seniors, they're going to be out of this world, and not just with this project overall. So kudos MTSU. We got a great squad. Please don't leave because, I like when I got good people. We can keep you all the years. And then finally, from Austin Peay State University, we have Trinity Mobley. She has been with me for 3 years. She, like Maurice, has a severe interest in mental health awareness, and she has done all of her projects each year on mental health awareness, and she's done a phenomenal job. It's hard because she's a sole person at Austin Peay and has been for many years. So thank you for staying with us, Trinity, so we can have representation at Austin Peay. So up first, Miss Sophia, and Catrice.
Hey everybody, give me 1 second to share this screen. Okay, y'all let me know when you can see it. Can y'all see it? Okay, cool. Hi everybody. So Catrice and I, we did our study on multiple myeloma. As Dr. Haygood said earlier, the study of our title was Unlocking the Mystery of Multiple Myeloma. I'm a first-year SHA at Fisk University, a sophomore, majoring in biochemistry and molecular biology.
Hi everyone, my name is Catrice Grigsby. I'm also a first-year student SHA, I'm a student at MTSU, and I'm a freshman, biochemistry major.
Okay, so getting into just what our research was about. As we said earlier, it was on multiple myeloma. The purpose of this study was to inform African-American individuals 18 plus about the risks, symptoms, and the overall existence of multiple myeloma, as well as to share resources for the affected individuals or those just wanting to learn more. So as Dr. Haygood said earlier, this was kind of a difficult project for me and Catrice to navigate because there's not much information out there about this cancer, and Multiple Myeloma Research Foundation actually helped us a lot on finding a lot of facts and figures for us to use in this project and the duration of it. So it is the most common form of blood cancer found in the African-American demographic, which is what surprised us the most because we are African-Americans and we have never heard of it. I mean, even being in the medical field, I've never heard of this before. So it was just really interesting to go along this project and learn more about it.
We held 2 listening sessions for this research. We were initially just going to hold one. The Multiple Myeloma Research Foundation really liked the information we got from our first one, so we held the second. Our first one held the demographic of African-American women aged 35 years and older who live in Tennessee. Our second listening session hosted college students aged 18 to 25. For our methods, we had flyers that we posted on social media, group chats, and by word of mouth. We collected our non-identifying data via Google Docs and held our informative presentations where we also got to hold wonderful conversations with our participants via Zoom.
And some data from the listening sessions. The first session, there was an 88% increase in knowledge among participants and a 100% commitment to biannual checkups. This was the 35 plus demographic. And we only held the second session, the 18 plus college age session, because Multiple Myeloma Research Foundation actually requested that we have another session with the college age demographic after seeing the results from the 35 plus demographic. The second session, there was an 84% increase in knowledge and a 95% commitment to biannual checkups. And the first session, the 35 plus demographic, we had 35 participants. And then the 18 plus demographic, during our second session, we had 107 participants. The outcomes of this study, the increased knowledge among participants means that this study was effective in achieving a desirable outcome, and focused efforts as demonstrated in this study can bridge knowledge gaps and empower communities.
Our lessons learned and our acknowledgements. Our first lesson was the amount of apprehension that was coming to clinical trials. We asked the question, would you participate in a clinical trial if you had a major illness? Out of both of our listening sessions, 3 to 4 people said yes. And that was very shocking to us. We didn't realize that apprehension was still there in the community. A lot of people talked about the Tuskegee experiment and Henrietta Lacks as the reasons why they're very apprehensive. The second lesson we learned was the difficulty to find information about multiple myeloma. We knew that it was a rare form of cancer. We didn't realize that would also be about the research that was there to find it. We just think that obtaining information should be easily accessible. It needs to also be easily digestible, because some of the information we found was very scholarly level. And you're just like, if you didn't have the education like medical school, you probably wouldn't understand what the papers were talking about. Then on to our acknowledgements. I'd like to thank Mrs. Haygood, our research coordinator, the Jackson, Tennessee Delta Sigma Theta chapter. They were the only chapter that reached back out to us to accept our 35 and older population. Multiple Myeloma Research Foundation for giving us all the information that we use in our research, and the Meharry Medical College HBCU Wellness Project.
Cool. Thank you guys so much for listening. I don't know how to stop sharing my screen.
I got you.
Okay.
Hello, everyone. My name is Amaya White. I'm a freshman at Middle Tennessee State University, and I'm a first-year student health ambassador. So to start, my project is called A Conversation About Postpartum Depression and Infant Mortality. The purpose of my project was to, one, increase awareness among African-American women ages 18 and older on the effects of pre and postpartum depression and how it pertains to low birth weight, which can lead to infant mortality rates to rise, and to provide local resources related to pre and postpartum depression. My research population was aimed towards African-American ages 18 and up that attend Middle Tennessee State University, as well as those who reside in local areas such as Murfreesboro and Nashville, Tennessee. Methods. My methods were, we used social media platform for Instagram to get out our flyers. We had about 40 participants that were surveyed. We used Zoom to have our informational presentation. We collected our data for our pre and post test from Google Forms, and we had an on-campus community partner from the National Panhellenic Conference. For outcomes and data, over 85% of our participants were able to identify the symptoms of postpartum depression. 100% of our participants all agreed that medical attention should be sought if escalation occurs. This escalation would be an increasing of symptoms of negative thoughts, of anxiety, of overall depressive moods. And all of our participants also agreed that they learned something new from our presentation. Some of the data that we collected was that from our post-test compared to our pre-test, that most of our participants understood the difference between baby blues and postpartum depression at the end. Another big data point was that they understood that men can also have postpartum depression and that they perceive it in a different way. Whereas women can have prenatal postpartum depression and postpartum depression, men can have postpartum depression once the baby's here, which was very interesting to learn. Lessons learned. Most of our participants had a general understanding about depression, which definitely coincided with postpartum depression. Additionally, our participants knew about the main symptoms of postpartum depression, which are fatigue, negative thoughts, long-term negative thoughts, and change of overall mood in a negative manner. Additionally, their general misconception between baby blues and postpartum depression, we were able to fully understand that and understand the difference between about a 6-week period after birth is considered baby blues of negative mood versus a long-term postpartum depression. And finally, participants were intrigued by the connection between therapy, a physician, and possible treatments. This was very interesting because a lot of people typically shy away from medical treatment, thus like medication, when you are pregnant to help with postpartum or prenatal depression, but our audience was very intrigued about it. They were asking questions about different options you can do with therapy, connecting with the physician, and going through with any method that's necessary. And finally, I would like to thank my community partners, the HBCU Project, Ms. Christina Haygood, the Eta Psi chapter of Alpha Kappa Alpha Sorority Incorporated on campus, Ms. Tiffany Reed Johnson, who's helping me with my research, and Middle Tennessee State University. Thank you.
Okay, hello everyone. My name is Trinity Mobley and I am a student here at Austin Peay State University. And my research this year was still focusing on mental health awareness, but I want to take a deeper dive into depression. So first off, just what is depression? Depression is a widespread, severe mental illness that has an adverse effects on thoughts, feelings, and behavior. African Americans who suffer from depression may exhibit a variety of symptoms such as excessive crying or chronically depressed or anxious mood, anger, exhaustion, feelings of hopelessness, and thoughts of suicide, unfortunately. And what I also want to kind of slide in here on this particular part is just that it was a tremendous amount of signs and symptoms that differ from African Americans compared to every other ethnicity or race. So I found that quite interesting. Prior to attending college, over 50% of Black students had no prior mental health education. Approximately 34% of Black students said they had trouble functioning because of their depression being so severe. Compared to 48% of white students, only 21% of Black students with mental health problems receive a diagnosis overall. And I also realized that that could be, maybe a lot of Black students don't have health insurance. They're not able to maintain or even access those available resources sometimes, just because not everybody has the same situation. So how I did my event, I held a virtual event over Zoom, and I had my adult psychiatrist, which is also an addiction psychiatrist as well, Dr. Shakivia Johnson. She came and spoke at the event. That was very informational. So my first objective was to provide a pre-survey and a post-survey. Second one was to find a target population to participate, which was my target African-American college students. My third objective was to raise awareness, which includes like the different types of depression, how to notice the signs and symptoms of depression, and to utilize local resources to help one treat this mental illness. And I realized that there is plenty, really more resources on campus that I could even think of when it comes to counselors and therapists that is really free of charge, and you don't really need health insurance. My fourth objective is to have the African-American students feel comfortable in seeking help, talking to a professional, and just not be afraid to speak up. Some more objectives that I did have was to just inform African-American students of depression, because I realized when I did hold my event, a lot of us did not want to even reach out for help or even just admit that, okay, I am having signs and symptoms of depression, but I'm just going to kind of throw it over my head, throw it over my shoulder, when in reality, it's not going anywhere. It's staying on your back, and you're still going to feel that weight. And another objective that I also had was to encourage these students to reach out again for help, because depression can get very, very serious, and you don't want you or anybody else to fall into a hole where it's very hard for you to get yourself out. And my last objective was to mainly just build strength in these participants to encourage them to fight against depression while also trying to utilize resources available so one really doesn't find themselves in that hole. So the outcomes from my event, I had 45 plus participants join the virtual event. I had a technical difficulty with my pre-test where I wasn't able to see the responses, but I took this as an opportunity to reflect on my previous work with depression. And I saw that there was a 55% increase in knowledge on how to not only notice the signs and symptoms of depression, but how to also just cope with the mental illness. Just really to even in general take the simple basic steps as is simply just acknowledging the signs and symptoms. There were several ways on how to cope with depression and just raise awareness with depression provided by Dr. Shakivia Johnson. She gave numerous amounts of ways, just even ways where you don't have to be so vocal on trying to tell somebody. You can kind of just take your time, and when you're ready to reach out for help, the help is always going to be there and available for you. And I also wanted to say that I realized with my event, a lot of us, how we don't want to reach out for help or even just say anything about depression. It all starts with acknowledging that, okay, I'm not okay. And I feel like with the Black community, we're always so pressed that we're supposed to be the strong ones, especially Black women. We're always put in a field to be strong. We're not allowed to cry, show signs of weakness, and everybody has the right to feel not okay sometimes because life is life. And with all that being said, I want to thank Ms. Christina Haygood for being my helping hand throughout the whole way. I wanted to thank the HBCU Wellness Project for giving me another opportunity. And I just wanted to also thank Dr. Shakivia Johnson for being my speaker once again for my project. Thank you again for this opportunity. I hope everyone has a blessed night.
Ms. Fisher-Smith?
Good evening, everyone. It is indeed a pleasure to be here. I'm so excited seeing all the great work that all the students are doing across the state of Tennessee. Kudos to all the schools, all the coordinators, and all the students. Tonight, I would like to introduce my two students. First up is Maya Lennon. Maya is a senior. She's a biology major, and Maya is a very accomplished young lady. I do apologize for the background. Miss Julia wants everybody to know she's in the room. So Maya is a very accomplished young lady. She's had her work presented at several conferences. Next up you will hear is Paris Tenen, also a senior biology major. Thank you.
Okay. Hello, thank you for having me. My name is Maya Leon, and I did my research on hypertension, specifically stress-induced hypertension, where there isn't any comorbidity attached to it, such as diabetes or or anything that may affect like your overall health outside of stress. So the purpose of my project was to increase awareness about how stress can cause hypertension amongst African Americans. People who are uneducated about stress really don't understand how stress can affect your physiological state. And my research was just to kind of address how us as African Americans in the college environment can get really stressed out, and that can cause us to have adverse effects on our blood pressure. Okay, so what we did was we partnered with a local yogi, and I had our college physician, Dr. Wesley Hawkins, came and he presented to the students about what hypertension was and how it can be, how stress can cause you to raise your blood pressure. The yogi did a presentation on different stretches and relaxation methods that can be used to decrease your blood pressure as well. She talked about mental health and how just taking a moment to relax and center yourself can be useful to lower your heart rate. So here are a couple photos of my target of my group. Most of the students were age range 18 to 25, but we did have a couple people from like college staff come and participate as well. Some of my expected outcomes was that the students would know what hypertension was after they finished the event. They will have healthy coping mechanisms on how to deal with their stress, and they will get an understanding of how hypertension disproportionately affects African Americans. Some outcomes of my event was that I had participation over 45. Dr. Hawkins did a really good job leaving the students with impactful information so that they can walk around and say confidently they understand the causes of high blood pressure. I also did a survey to evaluate whether or not the students ate unhealthy food to cope with stress that contributed to their health, to their high blood pressure. And most of them did say that they did eat sugary snacks or things like that to cope with stress as well. In conclusion, some further steps that I can do to help with my project would be to extend my reach, maybe get an older target group and see how they would fare with doing yoga to see if that would kind of help reduce their stress levels. Also take the blood pressure before and after the event to see if there's like any real physiological changes that we can observe. I just want to thank Ms. Fisher, thank HBCU Wellness, and I just want to thank everybody that helped contribute to my project. We also had the senior class at my college partnered with us, as well as an organization called Active Minds that helped bring some materials as well. So thank you.
Good evening. Can y'all hear me good?
We can.
All right. Well, my name is Paris Tennant. I am a senior biology major at LeMoyne-Owen College, and my project was on mental health, more specifically suicide awareness. All right, we will be going through the purpose of my project, the methods I use, expected outcomes, and the results. The purpose of my project was to raise awareness in the African-American community among people ages 18 through 25. For the most part, a lot of people don't know any healthy ways to cope. They turn to negative things like drinking or smoking. And I wanted to show the students of excuse me, my campus that there are better ways to get through the things that you go through on a daily. Okay, so I partnered with the Tennessee Suicide Prevention Network and Lane College Health Services to host a pajama social on campus. I had a student-led panel with questions I had researched and found myself. I administered a pre-survey and door prizes, tickets for door prizes. And the panel spoke on suicide prevention, warning signs, healthy coping mechanisms, and the importance of mental health. Some expected outcomes I was hoping to have were to lower the suicide attempts made on my college campus by educating the students on ways to detect warning signs and the risk factors of people planning on committing suicide. With this project, I had hoped to implement safe zones around campus for students to go to just have some time to decompress. They'll have somebody there to speak to if they need someone to talk to, or if they're having a bad day, they can just go and sit there in silence if they want to. And also, it was to raise awareness of mental health and its importance. So we had 48 students to attend, and 19 of them admitted to struggling with mental health, which I felt was a very low number given the fact of how many people came. Out of that 48, 14 people indicated that they were aware of the mental health services that were available on campus, and 22 weren't comfortable discussing their emotional health with mental health professionals on campus. So for future references, I do plan on trying to find a way to help them in a way that they'll feel more comfortable with speaking about what's going on. And majority of the attendees admitted that they didn't struggle with mental health or had any problems coping. For the most part, I can say that my project was a success. We had a great turnout, and I just want people to know it is okay to not be okay sometimes. You don't always have to put on the front a smile every day. It's okay to have some time to yourself and get it together, because at the end of the day, the day will get better. My apologies. So I would like to end with this quote: grow through what you go through. Thank you.
Dr. McMorris?
Good afternoon, everyone. I'm introducing Janila Holcomb. She is an agricultural major, and she is an agricultural major, and she's majoring in biotechnology, and she wants to continue on to go on to graduate school. And so she is also has a minor in biology. So the next voice you will hear is Janila Holcomb. Janila.
Good afternoon. Give me 1 second.
Using my speech.
Okay, I gotta open my system preferences. Okay. Let's just go ahead and talk, if that's fine. I am Janila Holcomb. I am a junior agricultural sciences major with a concentration in biotechnology from Prattville, Alabama, and I also have a minor in biology. And I am a student researcher at Tennessee State University, focusing on COVID-19 vaccine hesitancy. As we all know, COVID-19 was caused by the SARS-CoV-2 virus, which spreads through respiratory droplets from talking, sneezing, coughing, or contact with contaminated surfaces. The symptoms include fever, cough, and difficulty breathing. The global pandemic led to a widespread of closures of businesses, schools, and government offices, resulting in employee shortages and significant strain on healthcare systems. Tennessee specifically had reported 28,000 fatalities from May to August of 2020. And prevention efforts include, wearing masks, maintaining social distancing, and practicing good hand hygiene. And my research focused on students between the ages of 18 to 25. And my methods that were used, I recruited students via social media and also through flyers and group chats. And we met in a conference room and a building that I had classes in. And, we got content through the IRB research. And my outcomes were, for the questions 4, 5, 6, and 8, for 4, do you think COVID-19 is preventable? 52% said yes, and wearing a mask would prevent COVID-19. And the other 48%, they said yes, such as social distancing and good hygiene. Question number 5 is, have you been vaccinated against COVID-19? If so, what prompted you? 74% said they were influenced by college, work, and parents. And question 6, what information do young adults need to know to prevent COVID-19? 57% said good hygiene would aid in prevention, and 22% said wearing a mask would aid in prevention. And for question 8, for young adults like myself, what would be the best strategies to inform about COVID-19? And 87% said social media, flyers, videos, and campaigns. And 13% said no preference. The lessons I have learned is that effective communication is important. So using social media and platforms that are favored towards students from 18 to 25. And also with COVID-19 increasing and with it changing, we need to make sure that we also tell students, the importance of being vaccinated. And I would like to acknowledge the Meharry HBCU Wellness Program and Dr. Avetta McMorris. Thank you.
Dr. McMorris, do we have a second presenter today or tonight? You are on mute, so we can't hear you.
It's right here. Yes, Peyton Wright is on the line. She is supposed to be presenting, prepared to present now. Peyton?
Yes,
Peyton?
give me 1 second. I'm getting the website ready. I'm sorry, I had to step away from work. So if you give me 1 second, I'm trying to pull it up on my device, please.
Peyton, if you're unable to access it from your phone, you are more than welcome to just talk us through it.
Can you hear me?
We can.
I was trying to get it pulled up on the screen. Is it a way screen share? Oh, I'm sorry. Here we go. Give me 1 second. I'm trying to do it. Is it working? Can y'all see it?
We do not see it at this moment. No, ma'am.
Give me 1 second. It says pulling up on my end. If not, I will just walk y'all through. I'm sorry. No, still not working.
It's not, but go ahead and just walk us through it. It'll be
Okay. Give me a second. Here it is right here. Okay, so mine was over COVID-19. Let me turn my camera on so y'all can see me. I'm sorry. Can y'all see me now?
We do. Hello, hello.
Hi. I did my project over COVID-19 hesitancy. For starters, just some background knowledge about the project. The coronavirus is a contagious disease caused by the serious COVID-2 virus, which created a global disruption. The disruption was because of the virus rapidly infecting thousands of individuals, resulting in extremely high death rates around the world. The purpose of my research was to gain valuable insight on contributing to vaccine hesitancy and the increase of vaccine rates among ages 18 to 24 years old. This group has the lowest vaccine rates. While doing it, some outcomes that I found when I asked the question is, when you hear the word COVID-19, what word comes to your head? 81% said fear, as well as the wrong quarantine and social isolation. They said those words make them feel very uneasy, and like that's kind of how COVID-19 made them feel. And just all over, the other 19%, they just all over had another negative impact about COVID-19. The next question I asked is, do you think COVID-19 is preventable? Yes or no? 80% said getting the shot and wearing a mask, social distancing can help you stop from getting it, but as it being prevented? No. 20% said no completely. They said they feel like it's no way to stop you from getting COVID. And then again, another one I had asked was, have you been vaccinated? 55% say they know that they haven't been vaccinated due to misinformation, untrust, and they feel like the vaccine was created extremely too fast for them. 45% said yes, they got it either due to the fact that they had to get it to come to college, work, and to protect family members that were already ill. Some young adults said that they feel like if we presented more information on social media, not more so in like an aspect of we're talking to them, but more so in the aspect of like we're trying to get a better message across, that they would probably be able to understand more of the information behind it. 15% said that the daily news and internet articles were just kind of boring to them. which made them not research it very much. And my last question that I asked was, what other devices would you like to see, or what other social media platforms? Of course, we know TikTok is a big one, but it was recently banned from certain states. So we also know that we can't use that. A lot of them said to get away from social media as a whole and to come back into in-person interaction, just bringing different people to the school and showing them like at tabletop, and just having a human to human interaction would be a better way than social media. But also some said that Instagram, even though TikTok and Snapchat and other platforms of that nature will also be very helpful for them. And that's the end of my presentation. Thank you, guys.
Thank you, everyone. At this moment, we're going to pass the mic to Dr. Kim.
Well, good evening, all of you. First, just a warm welcome and a thought of gratitude and appreciation for the work that you've done. You may not realize how impactful your work is for the community, and your dedication to the science, because when we have to fight between fact and truth, science is what gets us to the other side. And by focusing on the science and taking the time and the energy to do what you did, but do it correctly and do it right, is something that cannot be overstated. You all did amazing jobs. The subject matters that you focused on are so important to the communities of color across the state. And you've made a difference. You may not realize it now, but you've made a difference. One person that you may have talked to, listened to, may have the opportunity to talk to 50, 100, however many people, and change their point of view, change their mindset, change their knowledge, and change their health, and possibly their longevity and life expectancy, all because you took the chance to be a SHA. And that can't be underemphasized. So from me, who, as Dr. McGee said, I spend the time trying to make sure that we find other ways to get you guys involved, to get more students to be able to do this work, and to get compensated, because that's important. I am proud of you. It is an honor to listen to your presentations and to continue this work into this next decade. So thank you again. Can't wait to see where you all end up. But I do know wherever it is, it'll be making a difference. So thank you again. And I'll pass it back on. I'm sorry, I didn't even realize my camera was off. I was like, where's my picture? There I am. My camera was off all that time. So just thank you. And I'll pass it back.
Ms. Hagan, we're ready for you.
Oh, I was waiting on Lisa. Look, I'm going by the program.
There's always a little change.
Well, this part comes a little bittersweet for me because we do the senior acknowledgement. And it's tough because, you know, we want you guys to stay with us for multiple years. And some of you do get the opportunity to stay with us for 2 and 3 years, some of you for a year. But within that time, we get an opportunity to know you. So it's bittersweet. All of the seniors this year, I'm so excited because this past summer, we were able to have the Summer Institute in person again for some days. So it was back to the fact where we got to see you, we know you now, because during COVID, it was tough to do that. So now please say, there are a couple things I know personally for the Fisk students and even the University of Tennessee at Chattanooga that I don't know for the other schools. So I don't know if all of you have been accepted to any graduate programs, but for the ones I know, I am going to shout out, even if I embarrass you, especially my students, because I like, you know, for people to know the great things that you are doing. But first up, congratulations to the graduating seniors from the Fisk University, right across the street from Mary Medical College. Charisma Beatty, whoop, whoop. She has been accepted to the University of Tennessee at Knoxville for a graduate program. Miss Aaliyah Riddle who was going to be a whole lot of places. She was just inducted Phi Beta Kappa, and she is the current Miss Fisk University. So I'm going to miss you, Aaliyah. You've been with me since 2021 as well. Mr. Maurice Thomas II, we do not forget to say the second in your name. He's been accepted to several programs. He doesn't know which one he's going to, but just to say he has been accepted to an Ivy League institution for one of his graduate school acceptances. So congratulations, Maurice. Chauncey, Zay, congratulations. Graduating, it was good to see you. And to all of you who were at Zula, congratulations on jobs well done. You did a great job, Zay. Jamil Muhammad, I don't know where you're going, if you're going anywhere, but I know you're going to do something great because you will have a 4-year college degree after that. Lane College, oh, we love Lane College. You're a little closer to us than all the other schools, and so we have some special relationships. But Jada Kane, congratulations. Topanga, you're funny. I love Topanga.
Thank you.
You're welcome. Christian Lee, Maya, who I know will be with us this week when we talk about how to submit a competitive graduate school application. We talked about it at Zula. Maya Leon, Thomas McCauley, Tiffany Newton, and Miss Paris. Congratulations to the Lane College students. And Miss Brianna Evans. We cannot forget our University of Tennessee at Chattanooga student. She has also been accepted to a graduate program in occupational therapy at the University of Missouri. She also got accepted to Duke University. So congratulations to Brianna as well. Congratulations to all of our graduating seniors. We just want you to know if there is anything you need, recommendations. I know, you'll be applying for fellowships and assistantships or whatever it is. So please don't hesitate to reach out to any of us for assistance. I write a mean letter of recommendation, but as my students will always tell you, I need a minimum of 2 weeks in advance. So congratulations to our graduating seniors. We're going to miss you very much. So next up is kind of, because you go from a high to a maybe not so high. This is very surreal for me to even do this. It's a special recognition for a valued community partner. Dr. Demita Bryant has been with us from very early on. She is a longtime friend and supporter of the HBCU Wellness Project. We are going to miss her greatly. One thing I would like to say is that many of our students didn't even know she was ill. I personally didn't know how ill she was. At the very last minute in February, we were doing some planning, trying to get the MTSU students projects solidified. And for a week's notice, I asked Dr. Bryant, would you be able to present for one of our MTSU students? So in February, even though she was extremely ill, she did not mention being extremely ill. She just accepted the call because she had a passion for health disparities reduction. She also had a passion for fostering growth in students. And so I don't ever remember her ever saying no to any of my students over the years. So what we'll do now, we have some comments from students who worked with Dr. Bryant over the years, because she really did make an impact on all of us, but particularly the impact she made in the community. So the first one up is from Ms. Tempest Janelle Black. Go back one, Jonay. There we go. I am Tempest Janelle Black, a first-year student health ambassador for this amazing program. Fortunately, I had the honor of Dr. Bryant being the speaker for my cardiovascular presentation this past February. Dr. Bryant was both a sweet lady and a remarkable community partner to me. I appreciate her so very much, and I thank God for blessing me with her presence. May her beautiful soul rest in peace. And this is from one of the current student health ambassadors at Fisk University. Dr. Bryant was always willing to help, and she was my community partner for 2 years. She was very thorough and informative during her presentations, and I am confident that participants gained valuable knowledge during each presentation that she gave. She will be deeply missed. This is from Bria. Like I said, she did 2 projects. The COVID one she talked about. This is for the one where she worked with stroke and heart disease. Dr. Bryant was such a kind and brilliant person. I always learned from her valuable presentations and truly appreciated all the advice she ever gave me. She is a soul that will be missed. May she rest in peace. This is Nia. Nia Wilson is a former student health ambassador who worked with Dr. Bryant for 2 years. And she said, when I first got accepted into the HBCU Wellness Project, my heart filled with an immense amount of gratitude. For those who do not know, the HBCU Wellness Project allows HBCU students to research a particular health disparity affecting their community. I selected heart disease and stroke, and to my pleasure, Dr. Bryant collaborated with me during my 2 years in the program. Dr. Bryant was a well-decorated woman with a deep understanding of heart issues and a passion for pouring back into the youth and community. It was a pleasure to have the opportunity to work with her, learn from her, and pour back into students with her by my side. Her overwhelming support throughout my project allowed me to maximize my opportunity within the program. May her legacy live on, for she has touched several lives, including mine. That's from Nia Wilson. And last up, Nyla Long, who also worked with Dr. Bryant. She's a former Fisk University student health ambassador. Dr. Bryant was lively and engaging, and was a huge help in educating Fisk students in 2022 for the Heart Initiative. She was relatable and made leading a healthier lifestyle seem achievable even for college students. She will be missed, but her contributions to the Fisk community will remain forever. With all those being said, we will truly, truly miss Dr. Demita Bryant, and we appreciate her contribution to not only the Middle Tennessee HBCU Wellness students, but all of the students in our program. Thank you.
Thank you.
Dr. McGee, we're going to send it to you to take us to the next phase of our program.
All right, so while an invitation was extended to members of our Tennessee Black Caucus, we know that they are here with us in spirit. And not only in spirit, but we know that they continuously advocate for this program. And so we would like to just extend grateful appreciation to all of our legislative advocates for the state of Tennessee Black Caucus members of the 113th General Assembly. And for all of you who live in the state of Tennessee, please, please honor the work that they do by getting out the vote. Thank you so much. The Tennessee Department of Health, our Office of Minority Health Disparities Elimination Division, which is guided by Mrs. Charlotte Woods. We just extend grateful appreciation to all of their support, their participation, especially with the Summer Institute. They are always willing to connect with you students and provide you with information and resources that will help you, as you go forward in your projects. So we thank the Tennessee Department of Health, Office of Minority Health Disparities Elimination Division. We also would like to extend thanks to the Metropolitan Nashville-Davidson County Health Department, specifically for this year's funding of COVID-19. As you heard some of the projects, those projects would not have been possible were it not for the generosity and the commitment to Metro Public Health to figure out ways to connect better with 18 to 24-year-olds in this area. So thank you to them. And last but certainly not least, the Multiple Myeloma Research Foundation. We are extending grateful appreciation to all of the support and guidance that you have given, especially our inaugural cohort of students who worked on multiple myeloma projects. And we look forward to continuing the relationship and expanding what it is that we have learned about multiple myeloma to make sure that that information continues to reach our vulnerable communities. So thank you. And a huge, huge thanks. And thanks, the word thanks just doesn't seem adequate when we talk about our community partners, because we're not for our community partners. And you heard about one that will be tremendously missed, Dr. Demita Bryant. If it weren't for our community partners, our students would not have the framework to guide them to implement their projects in the community on the various topics that we work with. So we want to extend gratitude to all of our community partners, and we look forward to continuing this work. And grateful appreciation. Again, not enough words to really capture the gratitude that we have to our campus coordinators, Christina Haygood, Dr. Shawani Howard-Baptiste, Alexis Hurley, Dr. Calverta McMorris, Dr. Mikkel Richardson, Mrs. Fisher Smith, Dr. Andrea Stevenson, and Mr. Greg Talbot. Thank you. We would not be able to have the outcomes, to have the commitment of the students as you shepherd them through their projects each and every year, and you support them and advocate for them. And so we just want to extend thanks to all of you for the work that you do, because it does matter. And last but certainly not least, our HBCU Wellness Project staff. You see these names here. I called them out earlier, and I just want all of you to remember that for the most part, all of these names have been with this project almost since the inception, if not from the very beginning, within 10 to 12 years. So they bring with them a wealth of experience and understanding, especially in their respective fields of interest. So we want to thank them. We want to extend grateful appreciation to all that they do. And so as we get ready to conclude, I just want to say to all of you, to our graduating seniors, as you go forth to serve, you can tell that I am a TSU alum, because that is the motto: go forth and serve. And that is what I ask each of you to remember, as you graduate and you begin the next steps on your journey. And to the returning student health ambassadors, I want all of you to let this significant contribution be evidence that really validates your achievement and capacity to make a difference. You heard Dr. Kim speak on what you do will make a difference, has made a difference, and will continue to make a difference. So often we focus on like those big feats of accomplishments, and not minimizing what you've done, because I think it is a big feat. But sometimes we define it by what we see on Facebook, what we see on Instagram, and other external media, to provide affirmation that we are important, that we are somebody. But we know that that's not necessary. Yeah, it's nice to do that, but what you're doing is really, really important work. It is your legacy to positive health outcomes. So the truth is that the best validation that we can find is from within. I remember talking to you all briefly about the 4 agreements, and these are the keys to feeling good, that having that inner peace. And I want to leave you with thinking about those 4 agreements that you make with yourself. You don't make it with anybody else. You make those agreements with yourself. And they're just simple rules to practice. It is not a shift that occurs like instantly. It's a shift that occurs over time through practice. So remember this: be impeccable with your word. If you say something, if you say you're going to do something, then do it. If you don't think you're going to do it, then say you can't do it. Just be impeccable with your word. Don't take things personally. And that's a hard one because we're human. And oftentimes we do take things that people say as a personal attack, but it really isn't. everyone has an opinion that absolutely has nothing to do with truth. Not your truth, perhaps their truth, but not your truth. Don't make assumptions. Ask questions to clarify things that are not clear. Don't walk away just assuming that what has happened or what someone has done is fact. Be bold enough to ask questions. And always, always do the very best you can. I know everyone didn't present in this forum. Your work will be on the website and Mrs. Woods will describe that more. But I can tell you that all of the projects that I read, it felt to me that you were extending the very best that you could. So continue that. Continue to always do your best. You know, I am working on practicing asking myself questions to sort of clarify why I'm feeling what I'm feeling, why I'm saying what I am saying, why I am doing what I'm doing, or why I might do what I'm thinking about doing. Well, all of that is necessary to really temper just responding based on feeling. As you've heard me say, feelings aren't facts. They're just feelings. So never be afraid to look beyond the surface to see where those feelings are coming from. Never be afraid to interrogate why you're feeling, what you're feeling, because all of this heightens who we are as human creatures. It makes our responses more meaningful if we take the time to ask ourselves those questions. I've watched most of you evolve, especially our seniors, as you graduate. And trust me, you all are magnificent. And so this is a journey, one of discovery. You're not going to get to the destination today or tomorrow even. Just continue on the journey, being open to looking at the things that you see along the way and asking yourself questions like, well, what does this mean? And how can this make me better? Never, and actually, when you think about it, that's what research is moving beyond what it is you see, looking beneath the surface to better understand something. What you have done will be an indelible mark on this project. Everyone can tell you that we keep these projects and we try to encourage students to continue the work that all of you have started. Now, I am looking forward to all the returning students being a part of the Summer Institute. So again, you gain additional knowledge, but I'm also interested in seeing how you evolve as individuals. And, you know, only you can really define that. I can't define that for you. The Wellness Project provides a structure for your development. And so I hope that you all will continue to use it and it be meaningful to you, you know, as you determine what it is that you want to do in your life. You know, we're here to support that. So we're going to close out, but before we do that, Mrs. Woods has some information to share with you, but I hope that you remember this experience and let it be a part of the full experience of the journey that you're on. Mrs. Woods?
Thank you, thank you. Now, before I close this out, I want everyone in the chat, let's drop all the emojis for Dr. McGee and for her guidance and everything she does for this project. So yes, I need to see the chat lit up. Yes, 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 yes. We love you, Dr. McGee. Okay, keep it going, but I'm gonna close this out. Here we go. All right, so some upcoming things to know. For our SHAs, you guys have probably already received this message via Blackboard, but we want to make sure that we reiterate that tonight that we will have our competitive graduate school applications webinar on April 17th at 6 p.m. We also will have our interview etiquette webinar on April 24th at 7 p.m. So again, you should have received those messages last week via Blackboard. You'll have direct links there, but take a screenshot, take a picture right now if you want to be attending those. Those will be led by Mrs. Haygood. Also, for our returners, or I know we have a lot of additional guests with us tonight, if you would like to be a student health ambassador on your campus, our application portal is now open on our website. You can go to hbcuwellnesstn.org/SHA app, or just click the button at the top of the screen and put an application in. Those get sent directly to our campus coordinators. They will coordinate the follow-up for that. So just know that our application portal is now open, and we are already planning for our Summer Institute this summer in person in Nashville. The dates are June 23rd through June 29th. So go ahead, students, mark that on your calendars right now. For those who have jobs, go ahead and put in those requests to get off, all the things, because we want to see you all back in Nashville for our next year, for our next program year, for our 2024-2025 year. So mark your calendars for that. And then SHAs, you know it, for any of our students who were with us this past summer, we are already gearing up for our Community Health and Wellness Expo. We also want to share this with all tonight's attendees. We have some community partners that are on the line. And so just know that we already are gearing up for our Health and Wellness Expo in Gallatin. It's slated for June 29th. Again, more details for that can be found on our website, /events. And then y'all know I'm so excited. Our SHA reports from the field are now live. They are on our website. You can scan this QR or go ahead and visit it. I'm just gonna show y'all because why not? We're so excited. So if you go over to the website right now, you can search by campus, but I'm just gonna scroll so y'all can see yourselves. Look at this. We've got Fisk, we've got Lane, look at y'all. Oh my gosh, we've got LeMoyne, Middle Tennessee State, TSU. It's in alphabetical order, y'all. And you can click right here directly on the site and watch more videos, more recaps, more data, all the things from our students across the state of Tennessee and the work that they've done. So you saw some of our presenters tonight, but there are so many more reports to be seen. So definitely go check that out. Keep a look on social media. Y'all know we will be sharing so much more throughout the rest of this month and May. I love how much you guys tag stuff and reshare, but let's really amplify the work that you've done, the research that you've captured, and just the health messages that you are sharing. Go on the website, check them out, visit our YouTube. They're on there too, and they're gonna be launching on social media in the coming weeks. So stay tuned, check it out. We are just so proud of all the work that you've done. And with that, we have completed another incredible Spring Symposium.